Hey, it's Charda, owner of Melanin Milk SD. I'm a mom, certified doula, childbirth educator, and lactation consultant here in San Diego, California, and I love teaching families how to be empowered and liberated in their reproductive and parenting experiences. So I like to teach mini childbirth lessons, and today this one is about positions that will help both you and your baby to prepare for an easier labor and some comfort measures for labor to keep you grounded, relaxed, and engaged during your birthing experience. Comfort isn't the same for everyone, especially in something so uniquely individual as birth. So today in this video, I want to cover a few of the most common ways to relieve pain and discomfort during labor and maybe a few that you haven't. So first, let me tell you what is not covered in this video, but is covered in depth in my blog. Sage, guided visualization, breathing and breath work, affirmations, dates, cannabis and CBD, epidural, and other pain medication. Find more information on these topics in relation to birth comfort measures on my blog, so visit melaninmilksd.com and click on blog, or follow my Instagram and TikTok to get new videos and join my mailing list to find out first. The one thing that is absolutely proven to assist in providing a more positive birthing experience and outcome is by hiring or finding a doula that you love to help you create the birth environment and space that you're seeking. If you look around on Instagram, ask friends, call birth centers, do your research, interview doulas that you might be considering, and narrow it down and hopefully find someone that feels right to you and for you and your family and will be the best support for you at your time of need. Doulas are also proven to reduce the need for inductions, painkillers, epidurals, and surgical births. I also like to call them belly births. And we are also associated with higher breastfeeding rates, shorter labors, and overall a more positive birthing experience. Doulas can also be present at cesareans. I have been present at many belly births, and it is absolutely something that you can have with you as long as you know how many support people you're allowed to have in the room at that time. Typically, it's only one support person at a belly. First, let's learn about a few comfort measures that can be used during labor to make your birth more enjoyable, and then after that, we'll get into birth positions. Number one, water therapy. We often think of birth pool, birth center, birth tub, water birth, but this doesn't have to mean when we talk about water therapy. It can be having a warm bath or a shower during labor, whether you're at home or at the hospital if you have access to these things. And the effects that the water have is very relaxing. It actually lowers your blood pressure, it decreases your risk for interventions, and it reduces your stress, which then allows your body to release oxytocin. And it also relaxes your perineal tissues, which makes you less likely to tear and less likely for the introduction of tools like forceps or vacuums into your baby's birth, which can sometimes lead to a traumatic birth experience. If your baby does end up needing a vacuum or forceps, I highly encourage you to seek out some body work for your baby just to help them get the kinks out. Infant adjustments at a pediatric chiropractor or prenatal chiropractor can often assist in helping your baby to work some of those kinks out that they might be feeling that might be preventing them from effectively breastfeeding if it is restricting the motion in their jaw or their oral cavity. Birth ball. Birth balls can greatly help during pregnancy and labor. Most hospitals or birthing locations will already have it there, so you don't necessarily need to bring yours from home unless you want to. They should have one, but always ask first. Maybe at one of your doctor's appointments, be sure to ask if they have that available in the labor and delivery rooms. If you're going to the hospital, if you're at a birth center, ask your birth center if that's have available to you. Sitting on a birth ball during labor can give you a sense of control over your body's balance and coordination when you feel like you don't have very much. And so this birth ball brings some stability into the situation, and you can rock your pelvis back and forth while you're on the ball or while you're leaning over. And a peanut ball is something that is like the yoga ball, but it's shaped like a peanut. It's something that they typically have at most birthing locations, and it's really great when it's properly inflated to your body's size and shape or deflated. And it's especially good for keeping the bottom half open for the cervix to continue to dilate and for the pelvis to stay open and for you to have room for your baby to come down and engage. You can even use this during early pushing to help keep your legs open, and you can even use it with an epidural, which is really nice, and I highly recommend using a peanut ball if you have an epidural. Use it to keep your knees in and your calves out, and this will create more space for the baby. 3, hot and cold therapy. Hot and cold therapy, you can use heat and cold during all phases of labor, mostly to soothe your pain and discomfort by decreasing the sensations that are felt. Store-bought heating packs or gel packs are fine. Then a rice sock trick is something that I make myself. I use it as a natural, inexpensive heating pad. There's a video for the rice sock on my TikTok and my IG Reels on how to make it, and it's great for labor and also for breastfeeding issues. So warmth is great for the low back during labor if you're experiencing low back pain. Cold can be used, store-bought cold packs, something from the freezer, can be wrapped in a towel so that cold is not directly on you. You can also use a cold washcloth that might be dipped in like a cold, an ice cold bowl of water or a bucket or a pitcher. And then you can wring it out and put it over the head, on the neck, wherever the birth giver wants it. 4, dancing. I love dancing during labor. And I highly encourage my clients to dance if they're up to it. I always have a birth playlist that has a bunch of different songs at different paces, and I can go from Beyonce to City Girls to Kirk Franklin, Marvin Sapp to Anya, all in the same birth. So it really just depends on the birth giver's mood. I like to use music in the beginning to boost the mood and keep the spirits high. And then when we're getting to the thick of it, I use it as a distraction or a focus tool, and we dance to the rhythm. So Bob Marley is a really good rhythmic type of music. Reggae music to sway your hips to when you're in labor. If you have a really good dancing partner, this can be really fun for you guys during labor. Dancing also encourages an upright positioning and movement and speeds up your dilation and releases oxytocin, which all might shorten the duration of your labor. Laughing, LOL. So maybe you need a good laugh after that dancing, because laughter really does help, and humor plays a huge role in reflecting pain. Just ask a comedian. It needs to be real humor. It can't be haha, it can't be a little, it has to be a really good belly laugh. Your eyes have to close, your face has to scrunch up, okay? Maybe you are crying, maybe you are clapping because it is so funny. And this is the kind of hearty laugh that we're looking for, because it triggers the release of endorphins, which is the body's natural pain reliever. And this decreases the number of bad stress hormones that prevents your body from relaxing. So laughter really is one of the best medicines. So watch your favorite comedian while you're at the beginning of labor. Watch a funny show. If your partner is like a Kevin Hart type of person where they can keep you rolling, then you're golden. And if you have a good doula that makes you laugh, I'm pretty good at making people laugh when they're in early labor. Just know when to stop joking. I usually know. Usually it's around pushing time or transition when things get a little, things get a little, we put the jokes aside until postpartum. 6, touching. When someone you love or trust touches you, it sends a signal to your brain and your body to relax and to slow down your central nervous system through that vagus nerve. So this lowers our cortisol hormone, and serotonin is then released, which is a neurotransmitter that basically acts like a natural antidepressant and a pain reliever. And so partner, this is a really good role for you to play, to do the massaging and the hands-on practice so that you can help flood that birth giver's body with positive sensations and help decrease their stress and anxiety. We finally made it to birth positions, and this is what you've been waiting for. This is what you're here for. How can I stay comfortable? How can I do these comfort measures to be relaxed and engaged and present in my birthing experience? We're gonna try a few different positions, and just remember that there's no one position that's best for everyone. And so position changes are really important during labor. You have to stay active and engaged through your labor to go the way that you want it to go. I strongly recommend you moving throughout your entire labor from the beginning to the end. Every 30 to 60 minutes is a good goal. And if you feel like you need some help during those position changes, ask for it. It's a really good reminder job for a partner. A doula will be good at reminding you to make sure that you're changing positions constantly, because as the baby drops down and becomes engaged and lower in the pelvis, it might become a little bit more difficult for you to move. Things might feel a little bit more heavy or uncomfortable as labor progresses. So this is a good time to try different positions. You can ask for a birth ball. You can use your birth ball. You can use a birth bar. You can use the wall. You can use a stool. You can use the bed. Everything can be used and everything should be used. You want to change positions to ease your contractions. It will also help shorten your labor, and it will help you have a sense of control to create that more positive birthing experience that you're looking for. And with position changes, it's best to avoid lying on your back. But if you must, then try using that peanut ball or some pillows to keep your legs open and your pelvis open to create space for that baby, and try to be in an upright position while you're lying down. With all of these positions, we want to do it about 3 times or 3 contractions, holding that pulse for the entire contraction at a time. And if it's side dependent, then be sure to switch sides for each pose and do that for 3 contractions at a time. You want to do this so that you stay balanced in your body and aligned and baby doesn't become malpositioned. So first we're going to try side lying with the peanut ball. You can also do this with a couple of pillows. Side lying with the peanut ball is great for folks who are super tired or have had an epidural, and it also takes the weight off the main blood supply to the baby and reduces tension on your perineum and your booty. Now I'm going to show you something called mermaid pose, but it's also known as flying cowgirl. Flying cowgirl or mermaid pose can be done in labor if your baby is not engaging yet. So it helps open the top of the pelvis by moving that pubic bone away from the spine. You want to let your body arch into like a half wheel shape to open the inlet. And when laboring in bed is necessary but the baby is still high, in this position, the soles of the feet can't quite touch together. Again, the knees are wide apart. The knees are as far away from the abdomen as possible. The back is arched and the pelvis is forward. If you can do it and your baby is not engaging, I highly recommend you ask your doula or your nurse or your medical assist you in trying this position. So sitting on a birth ball or leaning and kneeling on a birth ball, or on the edge of a bed or the edge of a chair while you gently rock your pelvis back and forth to ease the pain during contractions can be really helpful, can bring you a lot of relief during labor. If you want to remain upright but you no longer feel comfortable, this is a good option to try. You can also put a pillow down and kneel on that pillow as you lean over the birth ball or over the chair or over your partner's lap or legs. And this can especially help if your baby is pressing against your spine. So it's squatting. There's a number of ways that you can squat during labor for relief, as well as squatting for pushing when it's time to push. So let me demonstrate a few of the different types of ways that you can squat. So here are a few ways that you can squat during labor and birth and during pushing. You can squat with the chair. If you have a partner, you can lean in their lap for support while you squat. If we have a bed or a sofa, when we squat, we want to think about creating space for our baby. All fours is a great upright position for those who are getting tired during labor, or if the contractions become way too overwhelming or come too fast. All fours labor position can help you to work with gravity. It slows down your contractions and it eases your back labor, which occurs when the baby is positioned with the back of their head pressing against the rear of your pelvis. Keep going. Knees in, calves open. So the next one I want to show you is called the Captain Morgan, or I like to call it the Captain Hook. It's easier for me to remember. I'm a Captain Hook Peter Pan person. I'm also a Megan Thee Stallion Savage Captain Hook person. Leader pose is another pose that I like to call it because it's like a very firm stance pose. So let me demonstrate what that's like. You can use a stool, you can use a chair, you can use the bed, you can use the sofa. Simply take that leg up, put one leg up on the chair or the bed, lean during the contraction, lean in. The chair is nice because it gives you a little stability in that high throne position. So in this high throne position, you want to sit with one knee bent and the other knee relaxed. Don't lean too far back when you sit. You want your uterus to drop forward to improve the blood flow to those contracting muscles and ease pressure on your diaphragm. You can also use cushions, or you can use your partner for support to keep that bent leg up and as much open as you can get it. When a birth giver is having an induction that is starting to fail, baby is not engaging with the pelvis, with the cervix, and things are not progressing. I've seen a lot of success with this position. Sometimes it can become a little bit uncomfortable as we're in the transition stage and getting closer to the pushing stage of labor, but it is really helpful if you need some rest or downtime, or if you have an epidural. This is the last pose that I want to demonstrate for you. It's just a simple sitting backwards on a chair. Sitting backwards on a chair, or even better sometimes when you're at the hospital, is the toilet. And sometimes when you're at home, it just feels better to sit on the toilet. As labor is progressing, it's a really good way to keep things open. You've got that big belly sitting here, remember? Okay, so just sitting on the chair like this. Make sure if you feel like you're unsupported to have someone support your backside. Leaning in is really nice. It feels really good. Creating a little routine or a little dance of these positions during labor can help with the flow of oxygen to your baby. It can reduce the pain in your back. It can move the baby correctly into the right position. And when you're in labor, remaining upright and leaning forward helps reduce the pressure while letting your baby's head to constantly bear down on your cervix. And as a result, dilation tends to happen more quickly. And if you like these tips, please support my business by subscribing to my channel, reading my blog, joining my mailing list, or following me on Instagram or TikTok at Melanin Milk SD. So that's all the tips that I have for you today. Take what you want and leave the rest. Until then, happy birthing.